Well, hello, everybody. It's 1:31, so I would like to get started. Today, we have an alumnus of the Instructional System and Learning Technology program, Nicole Avarello. And Nicole's going to talk about adaptive learning, where she adapted a course from a paper-based module to an interactive e-learning course, I believe. And Nicole is a senior instructional designer focused primarily on enterprise learning and development and compliance at Atrium Health, the largest healthcare system in the Southeast, employing over 65,000 teammates. Historically, compliance training has been repetitive and disengaging from the user experience. There was a need for both the employee and the organization to let people prove their knowledge instead of forcing them just to click through a presentation. Nicole will walk us today through the process of redesigning the compliance education program from a static PDF to an adaptive e-learning course using needs analysis, content analysis, design thinking, scenario-based questions, and learner UAT design feedback. So I'm happy to welcome Nicole to today's session, and I'll let Nicole take over from there.
Awesome. Well, thanks, Dr. Klein. So I'm Nicole
worries.
Avarello with Atrium Health on the Learning and Organizational Development team. I've been in this role for 4.5 years. Prior to this, I was obtaining my master's degree and working as an instructional designer at the Learning Systems Institute at FSU. Before I dive into adaptive learning and compliance education, I'd like to hear from you. What do you think adaptive learning is, and have you used it before? Go ahead and just type your responses in the chat. Oh, someone took a class on it. Anyone else? What do you think adaptive learning is, and have you used it before? Learning that adapts with the learner input. Awesome.
Nicole, I think I'll just speak. I think
Sure.
Adaptive learning, sorry, this is Yao. I think adaptive learning is something like you present the learning sequence based on the feedback of the previous test or intervention or whatever. So that's my understanding of adaptive learning.
Awesome. Yes, thanks for sharing. I see a few more coming in. So I'm excited to walk you through some work I've done for Atrium with adaptive learning and compliance education. Here on the screen is how we've defined adaptive learning. It's any design that tailors a learning experience to the understanding, skills, and needs of each individual. To give you a real life example, think of a mother cooking with her children. She modifies the instructions, time spent on each step with kids at different ages. For example, a 2-year-old and a 7-year-old would need different instructions. She has to modify the time spent on each task because the 2-year-old may be allowed to stir the mixture, maybe dump some things in the bowl that's already been measured, but that 7-year-old might be allowed to measure things themselves and practice things using different numbers. So adaptive e-learning is similar, but we're adjusting that learning experience for each individual to meet their needs. So I want to know what you're most interested in taking away today. So now I'm ready for that poll. You should see it come up on your screen soon. How to design, develop, and implement adaptive learning, learners' experience going through an adaptive learning compliance education course, or what possible results, ROI, and success adaptive learning can look like. Awesome. It looks like a varied response here. I'm going to end the poll. Thanks for being interested and being here. We're actually going to cover all these areas and in that order. So let's get started. So adaptive learning and annual compliance education. I call this ACE. You may see ACE on the screen or hear me talk about ACE. And what was it? I designed and developed interactive adaptive e-learning courses. We did start with one, but ultimately there were 24 ACE courses. This was for all of our employees. We have about 46,000 enterprise employees and about 20,000 contractors and students. And this is for our annual compliance campaign. The analysis always starts in December and the course is launched July 1st. So why adaptive learning? We want to give teammates time back on the job. We found that learners were spending approximately 30 minutes or more in each course. For our clinical teammates, which is more than half of our employees, was about 40,000 then, and now it's 70,000. That's time away from patient care, so we really wanted to give that time back. Also to allow the chance to prove competency in the topics they were seeing year after year. Previously, learners would have to go through all the content to get through the mandatory exam at the end, and this did start in a very static PDF, and it was just moved into an e-learning, so there wasn't much interactivity. This was a huge challenge, and it gave compliance education a really bad reputation, making it something that employees dreaded. By moving to adaptive learning and adaptive testing, we were also able to reshape the format of the entire design, blocking or interleaving the content for each objective, along with the test questions for that objective to improve recall. By truly aligning the objectives to the content and to the exam questions, it was also a stronger cultural fit. As nursing is very evidence-based, it was easier to get our SME and stakeholder buy-in. And this also enabled us to accelerate their time to competency by aligning the objectives more cohesively to both the exam and the content. So this also reduced cognitive overload. A lot of companies address compliance training as a check in the box, just adding that extra training, and it doesn't necessarily address the behaviors. By reducing the cognitive overload, by providing learners what they need, we improve their knowledge retention, which ultimately improve their behavior on the job, which is the end goal of a good compliance training. With the previous way, after going through all the content and not passing the exam, learners would then have to go through all of the content again if trying to find or relearn one concept that they missed, and then retake the entire exam. So adaptive learning would really allow them to choose their learning path, which with an option to test out and only having to retake the objectives they needed. So our goals were really to increase learning attention so learners would receive the right content at the right time, create an atmosphere where the learner wants to learn and achieve mastery, really adapt to those learners' areas of strengths and weaknesses, and focus on mastery and competency. Mastery of those skills and behaviors versus completion, where the content is provided just as needed for each individual to really master the learning content and equip learners with knowledge, skills, and tools to be competent and compliant. So benefits of adaptive learning to any organization: it can provide a more efficient use of time, where learners aren't forced to sit through training that's not beneficial, both a waste of time and money. Increased learner retention, they're more likely to pay attention to learning that's relevant and more likely to be engaged. And learner empowerment. If learners can choose their own path, it brings a bit of control and empowerment to their learning. Creating the adaptive learning process, ADDIE was the primary process used to work on this adaptive learning experience, in addition to design thinking, scenario-based question design, user testing, and software development. So design thinking was used hand in hand with ADDIE. I had to empathize with SMEs who connected closely with our learners and know the struggles they're dealing with day to day. We had to define what does that look like in their world and really write relatable scenarios for the exam questions. We had to ideate how this could work. We tried a few different process maps and ideas and even demoed some companies to buy. We prototyped, put some things into action to see how they would work, and we did a lot of testing, some user testing to obtain direct feedback that could be implemented into development. So mapping the vision. During the analysis phase, the vision took on many iterations. While you can't see the details of the actual process maps pictured here, I just wanted to show you that I spent a lot of time planning what this could look like by process mapping. I mapped out different versions of what I envisioned these adaptive ACE learning courses could look like. Some different options I considered. I had different levels of content with different levels of exam questions. The scenario-based learning was an aspect in all of them. I had an option with challenges and tips for the learners. So we went through different maps of what this could look like. The final vision. Well, almost, because is it ever final? So we changed the 80% to 100% after talking with our steering committee due to this being compliance education. That was a concern they had. If our new hires were taking the same course as our tenured employees, that option to test out, they really wanted them passing it at 100% rather than an 80%. So what you're seeing here in this final vision is really the path we decided to go with. So learners start in that test, and you'll see that on the left side, and the test is broken up by objective. So they go through question by question for each objective, and then they get their score on that pretest. If they pass that pretest, which we changed it to 100% versus an 80%, if they pass that pretest with 100, they're finished. If they don't pass that pretest, then they're taken to micro content for each objective, and they only see that content for the objectives for which questions they missed. So they're not seeing the whole course if they don't need it. And then after going through the objectives that they need, they'll get questions again for the objectives that they're retesting on until they get that 100 on the test. So moving into the design phase, I really focused on objectives, questions, and supporting content. For the objectives, I worked with SMEs to ensure the objectives hit on the main learning points to support compliance and regulations for each course. The questions were redesigned for each objective, and this is where the scenario-based questions came in. We focused on meaningful, relevant scenarios that related to their day-to-day work, and then supporting content. The questions branched to that supporting content if they missed any of the questions, so that content was there to support the learners in learning those objectives. Are there any questions before we move forward?
I have one.
Sure.
How do you present and get feedback on what looks to be those pretty complicated diagrams for branching?
Yeah, that's a good question. The complicated diagrams were mainly used more internally with my team as I was just analyzing and ideating and coming up with what this was really going to look like. So I still had to present and get feedback with my team, but that didn't actually go to our stakeholders until the process was a little bit more defined. Did that answer your question, Kathy?
Yeah, thanks. I'm just curious. I'm always wondering about how you make these concepts real for your clients so they understand where you're going with it. Thank you.
Yeah, you're welcome. I think a short demo helps also, and we were able to do that once we were a little bit further along, but we just, to get the client buy-in and feedback up front, we presented them with more just facts and really the goals and the outcomes of why we were moving this way.
Nicole, this is Jiao again. You may have explained that earlier. I just want to confirm again. How do you identify the granularity? Like you have question level, you have the micro content. So how do you define like how deep you are going to do the adaptive? I don't know if you understand my question.
I think so, and that's why there are so many different process maps in the planning, because you can go really deep. You can have, 3 different levels, and this is easy, this is medium, this is hard. But But because we decided to build it versus buy, and I'll get there in just a minute, we stayed at a little bit of a higher level. We didn't get that granular with all those different levels. We talked about it and we mapped out what it could look like, but due to time, money, talent, all the things you have to consider when scoping out a project, we didn't go that deep.
Okay, great, thank you.
Yeah, thank you. So that brings us to build versus buy. I'm sure some of you are faced with that sometimes. It was time to develop and we knew what we wanted. So were we going to build it or were we going to buy it? We did look at two companies, Amplifier and AutoLearn, and some other similar companies, but companies like this often have a price per user on top of other development fees, additional costs if you want to own the content and then edit it yourself after it's complete. And we have approximately 60,000 learners. So knowing our organization was also growing, that was a huge factor in our decision for having to pay per user. So we did decide to build ourselves, but we also decided, knowing my area of expertise and my team's area of expertise and times, that we were still going to need a little bit of help. So we did bring in a tech designer consultant on the front end just to help get us started. That takes us to developing and getting started. So while we decided to build, as I mentioned, we did bring in a tech ID consultant to help us get started. And the first thing we did was build a template with directions and identify course variables and JavaScript. So up front, the main things we needed was this RT variable, which stood for retake. And we needed to know if they were retaking a question or retaking an objective. So that's how we used RT. And the Y or N for yes or no, which is commonly used in a lot of storyline development. So if RT question 1 equals N, that stood for retake question 1 no, the learner will not see question 1 again. But if RT question 1 was Y, so retake question 1 yes, then yes, the learner does have to retake question 1 and they will see it again. Preparing for the course variables and storyline, at the beginning for each course, it was very helpful to prepare these variables ahead of time before actually getting started with either modifying the template for the ACE course or building from scratch based off the template to meet the new course needs. Out of our 24 ACE courses, they were all very similar, but they could each have a different number of objectives and a different number of questions. So setting up this ahead of time really set you up for success. And then setting up or modifying the JavaScript needed for each course was really important as well. What you're looking at here is actually a screenshot from our template, and the JavaScript trigger is called out here as it had to be set up and modified for each course. The JavaScript only lived on one slide, and that kind of ran how it functioned, and then triggers and variables were used throughout the course. But in this one JavaScript code, it was really important that it matched that course 100%. So it had to be set up or modified for each course so it could match the number of questions and the number of objectives in that course so the course could operate correctly. Working with triggers. So if you've worked in Storyline or are familiar with it, triggers are the logic that tell the course what to do when you click on something. It could be as simple as show a pop-up or go to the next slide, or it can be as complicated as what we're doing here with executing JavaScript programming to create an adaptive learning experience. These triggers differed slightly depending on the number of questions and the number of content slide within each objective. We also needed different triggers for the different types of slides that we had in the course. There was a knowledge test instruction slide, we had content slides, question feedback layers, and result slide. Now this is where the magic happens. And that slide in the middle you see, it's almost like the engine block that everything else came out of and was operating off of. So I wanted to show you this image as kind of a far away view so you can really see all those connections and that everything was connected to that center slide. And we'll take a closer look at that center slide in a moment. I just wanted you to be able to see this. That main slide really branches to everything. It branches to all of the content for each objective. So those 5 lines are each an objective, and each objective has content slides. I see Rob's laughing, looking at the story view. Yeah, there was 24 of these, but this really helped to keep everything in order and see it this way too when working with the template and when working with the development, because I mentioned earlier how different triggers were needed depending on the number of slides in each objective. This really helped visualize that. You can see here only 2 of those objectives are the same with 3 slides in each. The others vary a little. I see 5 slides, 3 slides, 2 slides, 4 slides, 3 slides. So depending on those numbers within each objective, they had to be set up slightly differently. And also on the last slide in each objective's content is where we tell the course which questions to retake, depending on the variables and conditions if the learner needs to retake it again or not. So the learners will only retake questions that they have not passed. They will never retake a question that they've already taken. So here's a closer look at that main slide that was in the middle. And this is where a lot of the triggers and the functionality of the course live. So it's also very important to have this slide set up correctly. Here, the variables for retaking questions as well as retaking objectives play into effect. If learners see that they completed objectives, they'll receive a check mark. You'll see them grayed out right now because this was a developer view. Or if they failed an objective and need to review the content or retake the test. Essentially, all objectives need to be completed and passed in order for that arrow to appear at the bottom right, that gray arrow at the bottom right to appear, and then the next button will appear to move them forward to complete the course. So we went through development. Now this is the learner experience. And learners had a similar experience going through each of the ACE course. The first slide told them what course they were in and why they were taking that course, to which regulatory law or requirement it aligned to. This also holds the project team, our steering committee, and SMEs accountable and helps with our yearly updates and audits from regulatory bodies. The next slide introduced the learning objectives, and this informed them about the test. As I shared previously, the test must be passed at 100%. So for any questions not answered correctly, they'd have to review only the content aligned to that objective and reattempt those missed questions. After completing the test, the learners would see this slide that shows the objectives, and the screen also lets them know how well they did. The learners have to review objectives that do not have a check mark. So what you see here on the screen is what a learner would see the first time going through the test if they only passed objective 1 and needed to retake both objective and objective 2. Upon reviewing one of those objectives, learners are then taken directly only to the questions for that objective. If a learner goes through the content for the objective of which they didn't pass the first time and they still don't pass those test questions, now they have the option to retake the test or review the content again. So it's really up to them to decide what they want to do. Do they want to try again? Do they want to review the content and relearn the material? Or maybe they're totally stuck and they want to try the other objective and come back to that one. Whatever their choice is, they will always be working with just one objective at a time. Gone are the days where you must fish through an entire e-learning to relearn one topic or to retake one question. This slide was actually tweaked a few times based on our user experience testing and the direct feedback we got from the learners. After passing all objectives, learners see those check marks, and then they see that arrow and the next button appears, and that progresses them to complete the course. So I shared a bit about user experience and how I used user experience testing to get that feedback and improve the design experience. I'd like to hear from some of you now. What ways have you used user experience testing to improve learning? And if you just want to type it in the chat, that'd be great. Okay, I see Rob can't because of his budget. Pretest, so pretest is a little bit different than user testing, but pretests are important. So the way I did the user testing was during the development phase. I got together a group of individuals who agreed to participate in the testing, and we all sat in a computer lab together. I gave them some instructions, paper and pen, to write down questions, but I didn't want them to ask me questions until they were finished. I just wanted to observe them. I wanted to observe their experience. I wanted to see what they clicked on, maybe where they hesitated, where they were confused. I wanted to observe their full experience as if I wasn't there, if they were on their own doing it, but I did want them to write down any questions they had in the moment, and then we debriefed the session afterwards, and we were able to go through the course again. They were able to ask their questions, ones they had written down, new ones that had maybe come up while we were going through it again, and we were able to get their feedback.
Nicole, this is Jim Klein. I would suggest that many people on this call have done formative evaluation, and that formative evaluation is a form of user testing. And so throwing it out, let me ask the question differently. How many of you have done formative evaluation? Well, I know you did in 5603.
Yeah, that's a great way to think of it. And I also see another way to user test is to lean on coworkers if you don't have access to your learners. So that is a great way as well. My coworkers are my learners, so definitely.
Hey Nicole, this is Rob. I'm just going to jump in here because I said that we don't have it in the budget, but I actually have an international project that I'm working on right now for Uzbekistan, and we had to help them learn to develop student learning standards, and they needed a replicable process that was really transparent. And so early on, I designed a guide based on my experience here in Florida, and it was meant to be done in the workshop format. And obviously we had to change to virtual, but I was able to test that the activities in that guide with a small group of from our internal team. And then we did make adjustments to that whole process and all of the tools based on that user testing. So working with a really small group and then making the revisions and expanding out. You know, I don't think of it in terms of user testing. Like Dr. Klein said, I think of it more about formative assessment and being very responsive, but it certainly goes along with that. And welcome, by the way. I'm proud to see you here.
Yeah, definitely. Thanks, Rob. Yeah, that's definitely great ways to get that testing done, to get that feedback, and to improve, to improve your learning solution, your course, whatever you may be working on for your end users. So we definitely use that user testing to improve how some of the information and the directions were written, how they were presented to learners, to really help them with this new learning experience so they can move through it more efficiently, more effectively. And so really they could weigh in on that experience, since this was a new format for compliance education for us. Before I move to success, are there any questions on the whole development and learner experience section I just went through?
Nicole, this is Yao again. So based on the JavaScript, sounds like the adaptiveness happening at the core, I mean, happening within the course. So I'm just curious, are you still considering the adaptiveness between course, which means it resides on the platform, the learning platform?
Between course, can you tell me what you mean by that?
Like, for example, if you have course 1 and then you have the adaptiveness functioning inside the course for each, I would say each page, let's say between pages, you have the Java functioning running on that. But when you complete the course, usually, okay, this, I may have some of the old knowledge. The previous knowledge is usually the course would talk to the learning platform to transfer data. If, for example, if you set up one student complete course 1 and then complete and then move to course number 2. So between the courses here, those communication are controlled by learning platforms. So in that case, could the adaptive also happening between courses?
Yeah, that's a great question. Something we didn't look into, but definitely could be used to improve, our whole compliance education as a whole, because there was 24 at the time we developed all this, and now there's 26. So depending on your role, if you're clinical, if you're non-clinical, me as a non-clinical human resources teammate, I only have to take 4 of these courses. If you're clinical, if you're a nurse, for example, you're likely taking at least 20. So that's definitely something to look into, how the courses can work, adapt with each other, and maybe if they're all within, one program, and that would help with the audience, the assignments. I'm not sure how that would work within the LMS, because right now they're all in the LMS separately, and that's someone else's headache to deal with, those assignments. But that is a good point to look into.
Thank you so much.
Yeah, thank you. Anything else on development or the learner experience before I move to success and ROI? Okay. So what does success look like? We really wanted all exams passed at 100%, all new teammates to take this compliance education before interacting with patients or patient data, and all teammates to take the assigned compliance education within 30 or 90 days, depending on the assigned course. Now, what was needed for success? We needed lots of partnerships with subject matter experts to support in our annual content reviews and updates for those scenarios for the exams, partnerships with accreditation and compliance team to support and review compliance regulations and target audiences to ensure alignment, partnerships with leaders, teammates, and providers to review and test as needed, and partnerships with our steering committee to support for continuous improvement. Ultimately, we needed their buy-in as well for this adaptive learning, and they were the ones who requested the 100% pass rate from our previous 80%. Moving to results and ROI, we saw almost $500,000 in annual savings for our core 4 courses. So that's just 4 out of the 24 by moving every employee to adaptive learning. We saw a reduction in course time per attempt. And we actually, the first year, we only converted 23 of 24 courses, and the 24th one is now converted. And we got some great feedback. Many really liked it, but also some people didn't like it, and they were confused. We learned that Some people didn't like the 100% pass rate. And if they missed just one, they wanted to be done. They thought that wasn't good enough. And they didn't like having to go back, even though they were just going back to that truncated section. It was just a change. Like any change, we had to build in some extra change management, some communication, go back, communicate the why, the goals, the benefits. So this really included a lot of different elements in this project, dealing with those results and those feedback. And now most of our courses moving forward are built with this lens, because overall most of the results were positive and the feedback were positive. So we do use this format moving forward, this adaptive format. And I think that's where education is going. Even Articulate now has new features that allows for this easier development and pre and post test and assessment. So that's really neat to see. Expanding a little bit on those numbers, on the left, I kind of break down how we got to that annual saving. It was based on an average hourly rate that was provided by our compensation team. And then I have the formula there of what we use to get that savings. And in the table, you can see our core 4 courses, and that's what every teammate at my company has to take. And then you can see some of those average time spent in the courses before they were adaptive and now after they were adaptive learning, and the savings we were able to save for each course. Some next steps that I'm working on and my team is working on is just continuous improvement. We can always improve the design. We can work on the scenarios year after year, really partner with the SMEs and ensure that the scenarios are relevant, meaningful, related to the day-to-day work for the audience, and work on that audience as well. Continue to ensure we have the right audience for each course. We are a growing organization. We acquired a few other healthcare systems, and it's just very important to ensure we're capturing the right people needed to take these right courses. So that is a big task, and we can definitely work on improving that process. And then performance metrics as well. We focused last year on time savings, but we can continue to look at regulatory audit findings and benchmark where we are and where we were and where we are now, and what additional changes we can make to improve on those findings. Any additional questions for me?
Nicole, this is Jim again. I have a question about the idea of compliance training in general, and then
Sure.
specifically in this case. So were there any federal regulations or state regulations that you were, who were you having to be compliant toward, I guess is my question.
Yeah, so mainly the Joint Commission, but also OSHA and DNV. We have different regulations from those 3 regulating bodies, and on our ACE steering committee, we have representations from legal, from compliant, from our corporate compliance group, and from accreditation. So they really help to ensure, we're meeting those regulatory standards and that we have the right courses for the right regulations, and as well as the audience for those regulations.
So did you get any pushback from, typically compliance is time and seat, right? And so you measure how long they spent, and you say, well, they completed a course, and it's not based on, of course, you had compliance assessment here. So did you get any pushback from this idea that people could bypass the training if they performed 100% on the pretest?
So a little bit. The pushback was in the beginning when it was 80%. By moving it to 100%, they felt a lot better, especially because we reworked the exams entirely. Initially, the exams were whatever questions were in there when they were moved over from PDF to pictures of the PDF in the e-learning. And we completely reworked the exams. I aligned every exam question to an objective, to a content area. And then with that, almost every single exam question, if it could be, is a scenario-based exam question. So really speaking to the content and speaking to real life relatable work scenarios that they're dealing with. So they felt a lot more comfortable with the stronger assessment, and then moving it to 100% is how we got their buy-in.
And they meaning the people that the agencies.
Not the agency themselves, but the steering committee, and most of
Okay.
them are the ones who have to speak to the agencies when they come in to do an audit or a survey or any of that.
I mean, I find this really cool idea that you did. It's just I do know in some industries, I think banking might be one in which with federal regulations suggest it's like time in, you have to comply by spending amount of time or the amount of courses completed, not passing the pre to post exam. And so I find it very fascinating. I thank you very much for sharing about this.
Yeah, you're welcome. For us, I've seen some of the regulations. They're very gray. They're not black and white. You definitely have to educate on the topics, but they're not very clear to even exactly what has to be in it, who needs it. Sometimes it's all employees or clinical, at least for these healthcare ones. But there's, at least for ours, there's nothing about time, because how long it takes someone, even if it's a PDF or if it's an interactive e-learning, time could be different for everyone.
Are there other questions for Nicole?
Hi, Nicole. This is Megan Benson. I was wondering, for students who failed the assessment at the end of the micro module, if they were seeing the exact same content or the exact same questions when they repeated it.
Yeah, so that's a good question. And yes, they were. That was something we talked about previously when we were just thinking of different ways and process mapping. We thought about, level 1, level 2, level 3 questions, but we left it same questions, same content. So if they failed it, then they had the option to review the content or retake the questions, and they would go through it again.
Thank you.
Yeah, you're welcome.
Hey, Nicole, would you stop sharing your screen?
Sure.
So I have I guess we'll call this a special presentation to make, if I may. So several of you participated in the ISLT Alumni Student Mentorship Program when you were here as students. And you may not know this, but over the past 3 years, Nicole has been the person who's put, I guess, speed dated people, Nicole. I don't know how you might say it, but making those matches and getting students who want mentors and getting mentees. And then we added the EDD program on top of that. And so now she's got to match EDDs as well as the master's student. Anyway, so Nicole's been doing a lot of work for the program as an alumnus. And last year, the faculty wanted to present her with the Robert A. Reeser Alumni Service Award for service to the program. And we weren't able to have our event, obviously, last year. And so, Nicole, I just wanted to congratulate you and let you know that the faculty has selected you as the Robert A. Reeser Alumni Service Award. So congratulations, Nicole. That's exciting.
Thank you. Thank you so much. It's been a pleasure to work. Oh, I was just going to say, it's been a pleasure to work with the alumni and the students and see so many familiar names and now faces from doing some of these calls.
You will be receiving a plaque in the mail or something when we all sort of get back to campus. I'm sorry, there's no check with the award. It's just a little small token of our appreciation. And For those of you, I'm trying to see who's on the call. Kathy Tenza is a former award winner. Sue Ebers is a former award winner. And so we're happy to have you continue to serve the alumni. It's not like this is the end of your term or anything, but as long as you're willing to continue, we'd love to have you. And if it's time for you to say, let's pass the baton, then we'll pass the baton, but we can be in communication privately about that.
Happy to serve. Thank you so much.
So we have one more of these events. It is Friday, April 2nd, and it's going to last for 2 hours, 1:30 to 3:30. Demetrius, I believe, is going to put something in the chat now, and we sent the information out. So on Friday, April 2nd at 1:30 to 3:30 p.m., we're having a celebration of the life and accomplishments of Dr. Roger Kaufman. And several of you have read his work. Many of you know him by reputation. He is considered the father of needs assessment. He was a faculty member for many years here at Florida State who died last fall. And so some of his former students and co-workers at the Center for Needs Assessment and Planning will be sharing about how Roger impacted their life. And so I highly encourage you to attend that. And that will be our last session for the 2020-2021 academic year. So is there anything else for the good of the order that you all would like to bring up? Thanks very much, Nicole, and for all of your attendance and participation today and in all of these sessions. And then once again, Demetrius, you're great. Thanks for everything.
Thank you.
Bye, everybody.